As was told earlier, there are different options of treatment of neuro-oncology, and also the stereotactic radiosurgery. In Latvia here is, there are two options for Novalis, and recently the most modern radiosurgery machine is CyberKnife M6. There are a few differences between these treatment machines, and now I want to stay in a few cases. These cases will be not all what we treat for this period, but mainly those what we treat with other doctors. The interdisciplinary tumor board in the cases of CNS pathology, neurosurgeon, radiation oncologist, oncologist. Fiducial insertion for tumors of CNS don't need. Also, we need CT and MRI preparation, treatment planning, treatment, and of course follow up. This is our colleagues in Consilium tumor board, also preparation, and preparation, topography preparation, as was mentioned by Indra. This is 1.25 millimeter slices of CT, and we use for preparation 3 Tesla MRI to see the precise zone, as you see in this picture of this is the most recent picture of acoustic schwannoma, where we can see the tumor, we can see the cochlea. Yes, this is allows us for volumetric planning. Planning by our physics, and we can make the treatment, radical treatment after surgery, combination of different methods of radiotherapy with chemotherapy, hormone therapy, also salvage or palliative treatment to improve the quality of life of patients. Indications, the general indication for CNS pathology, this is the tumors or some another pathology about which I will tell later. Inaccessible for surgical removal tumors, medical contraindication for surgery. It's need clear margins, no diffuse, non-cystic tumors, and size also matter, because big tumors have no such good response for this treatment. There are contraindication for CyberKnife radiosurgery, the large size of tumor, as I told earlier, the significant mass effect and brain edema, compression of the brain stem, compression of the big compression of the visual pathways, hydrocephaly, diffuse, and cystic tumors. There are contraindication for this treatment. In our center, 105 patients with CNS pathology was treated since December 2015. The majority of these patients was patients with acoustic schwannoma, meningioma, and metastasis. Also, there were a few patients with cavernous angiomas, gliomas, AVMs, trigeminal neuralgia, and spinal tumors. As I told earlier, the main treatment goal is local control for newly diagnostic or recurrent tumor. It can be also salvage or palliative treatment. The condition of patient must be at Karnofsky scale 60 up to 100. Diagnosis also CT, MRI. In some cases it can be PET-CT or PET-CT with methionine. it can be provided by single fraction radiosurgery and hypofractionated radiosurgery. Meningioma is one of the ideal target for stereotactic radiosurgery, clear bundles of the tumor, no infiltration. Here it was one of the cases of the cavernosus sinus meningioma. This is the case of multiple meningioma, and this is the case and the results. One of the first patients which we treated, the petroclival meningioma, very hard to surgical removal of this tumor, and we have the results of this treatment after the 9 months. After the 9 months, we compare it at our multiplan system. We can load the plan and load the control images, and we see the reduce of the volume of this tumor after radiosurgery. The same situation is for acoustic neurinomas. We can treat it very precisely in 1 fraction, also to aware of the cochlea, and in this case there are 2 lesions, one the neurinoma, another meningioma, and the next case is the big neurinoma after surgery, also can be treated, and we have the result of the shrinkage of this tumor after the year of this treatment. Metastasis also there were the 1/3, a lot of patients here. The local control is high, but overall survival for this metastasis depend on RPA classes. And one of these case which I want to show, in this case I can show all possible changes in tumor for after treatment of this metastasis. Here is the breast cancer metastasis, relatively big with edema, and a young woman, 35 years old. She had 2 lesions, one in the frontal zone and another in the near the brainstem. We decided to treat her by CyberKnife, and in 2 months we got significant reduce of the volume of this tumor. But after 6 months we see the enlargement of this tumor, and it was the decision what to do, or it's need to surgery removal of this, or it's relapse of the metastasis. But we prescribe anti-edema therapy, and in 9 months we see this it became the decrease of the volume of the tumor. This is very good. So you should see at this metastasis, which is near the brainstem. Here was before the treatment. 2 months, it's almost disappeared, and 6 months it began the more bigger. But and it was very serious question by the patient, by the doctors from Lithuania, that they stress that it may be the relapse of tumor, but after 9 months we see the decrease of the size of the tumor, and this patient feels better after this in this time, because she did not get any medicamentation, any hormones. For pituitary adenoma also have non-functional pituitary adenoma after surgery, and corticotropic adenomas. In this case, we see the decrease of hormones in 6 months after cortisol level in 6 months after the treatment of after the radiosurgery. For gliomas, glioma is most challenging and most hardcore radiosurgery treatment indication, and we try not to take it very much, but sometimes in cases of salvage or palliative treatment we can make this treatment also, but we use in majority of cases also the additional imaging of mechanism. And here is you see the survival. Oh, sorry. Yes, and here is one of the cases which we can see the usefulness of this mechanism. We can see that the gross tumor volume we make all together with MRI before, and also the zone of mechanism enhancement, and it's make the tumor volume or volume what we need to irradiate bigger, and also there are some prescriptions for tumor margin. As for other pathology, it is not only the tumors, it's a vascular pathology, and we have also the patients with cavernous angiomas, which we need to treat by which we treat by CyberKnife. Yes, the majority of them had the evidence of the previous bleeding, and in these cases there is 20-30% of possible rebleeding, and that is why our goal is to reduce risk of bleeding. And here we also use the MRI, and a special MRI T2 regime, where we can see the hemosiderin enhancement, and we can precise see the lesion which we need to irradiate. AVM also, there were a few AVMs which we treat here, and we are still waiting for the results of this treatment. This young girl with relatively big AVM we treat a few weeks ago. Yes. Trigeminal neuralgia also is possible to treatment by CyberKnife. In this case is this patient, there were the surgery, there was a relapse of this pain, and we treated also by CyberKnife. Now he had the relief of pain, not almost, but at the half of pain scale it can be. What about spinal tumors? The advantages of CyberKnife is the possibility to treat spinal tumors, and we don't need in these cases any fiducials, because there is the system spine, and we can treat also in the cases, in the cases of previous irradiation, And here is one of the patients which treated here in Sigulda, and previously treated in 3 countries, in Russia, in Belarus, and in Latvia. And this patient with metastasis, TH10, renal cancer. The first was he had pain when he was in Russia. He got palliative radiotherapy, 24 grays. At this course, he became paraplegic. Then he go to Belarus, where he had surgery, decompressive laminectomy. He there began something motion in foods. After that, he come. We spoke with neurosurgeon from Minsk, and after that he come here, and we made PET CT. That was the single lesion. There was no any evidence of any lesion also, and we make also, I can say that this is salvage radiotherapy, yes, for this patient. He became better also here, because here in this hospital is a rehabilitation center, and he stay, he walk, but he also had some problems with his spine, and in 3 months after surgery, it was spinal instrumentation for this patient. I spoke with spinal surgeon, and he told me that usually these metastases are very bloody, and when he was the first surgery in Minsk, there was not the stabilization of this tumor, because it was very big bleeding during the surgery. And in this case, here, when he he had surgery in Latvia, he told that surgeon told that I saw the huge difference between irradiated tumor and normal tissue, and he can remove all remnants of this mass safely without bleeding, and stabilize this patient by this system. And and pathologists don't find any evidence of tumor cells in this part what he removed. This shows that we open for collaboration. We open for treat the patient in the fashion what patient need. Not only that we have CyberKnife. If we need to collaborate with our colleagues from Onco Center, with our colleagues with surgeons, and we are open for all this collaboration. Thank you very much for attention.